Hi, everyone. Welcome to our wonderful webinar tonight featuring Tempsure and being able to learn all the wonderful things it can do for ocular surface and dry eye, as well as eye beauty and all the other cool things Tempsure can do. We have a wonderful cast here tonight, and a lot of you guys already know these wonderful ladies because you've been tuning in every single month, which we so appreciate. We have a great time every month doing this, always the last Wednesday of every month at 6 o'clock, so everyone can be sipping their tea like me, trying to stay awake, or whatever is your vibe. I think we've got Lauren sipping some tea tonight too. She's nursing a little bit of some laryngitis, so bear with us. We've got Lauren from Cynosure, who is going to help us out, kicking some of this off. We also have Gabby, who is our advanced laser esthetician. She knows everything you always wanted to know, but were afraid to ask. And I ask a lot of those questions because I'm still learning on that. We have Miss Stevie, who does the prizes, the hostess with the mostest, and she always comes up with some fun things. And we have Miss Amy, who is our technician, our Tempsure technician, who's going to be doing a wonderful live treatment here tonight on Dr. Coulter. So, you know, Dr. Coulter, be nice, you know, Amy's right there. So she's getting nice and cozy and getting ready and prepped up for doing tonight's treatment. So we're going to kick it off with Lauren and Gabby. They're going to be talking about Tempsure. We're going to be sharing screens here in just a second, and then we'll do some question and answer, and then we'll be staying around for the prizes. Remember, tonight we're going to be giving away a full face treatment of Tempsure, as well as 20% off those of you who stay to the bitter end, and that's going to be exciting prizes tonight. So we look forward to seeing all of you in the flesh here soon. But for right now, we're going to keep doing our virtual events because, I don't know, I love them. I love them a lot. And I don't know about you guys, but I think it's nice when you can just do this from your couch and just relax and not have to get up and get all gussied up and come to the office, you know, and those horrible tight shoes, which we don't wear anymore. I'm so loving these scrubs and these tennis shoes. It's like making my day. So, all right, let's get the party started. Gabby, I'm going to have you share screens, okay?
Right, let's see how quick I can get this one.
I love it, Dr. Foley, though. I mean, honestly, scrubs, just like the whole new wave of things with COVID has been very, at least for me, warm welcomed. So thanks everybody for joining us tonight. So I'm Lauren. I work with Cynosure, who is the company that makes Dr. Foley's Tempsure, as well as her Icon device. So recently, I'm really excited. Actually, this will be one of the first times that we've shown this new marketing from Cynosure. We recently rebranded and kind of aligned to our purpose of bringing beautiful energy to everyone. And so as you'll see, whether it be through our events with Dr. Foley or maybe out in the community, you'll see these beautiful new marketing materials, which I'm super excited about. So Tempsure Envy actually focuses on the face. And, you know, tonight we called our event Eye Envy and Eye Beauty. And that is because a lot of times, right, especially through COVID, all we've done is start to focus on here and up because that's all we've been seeing. And so it's really wonderful to get to share with you guys tonight this treatment that, one, is super relaxing and enjoyable, but also helps us focus on our eye beauty. And specifically as it relates to dry eye, kind of helps us achieve some alleviation and results there medically. But unfortunately, regardless of why you're doing the treatment, you're going to get the aesthetic benefit. And so we'll start off and tell you a little bit about what Tempsure Envy is. So Tempsure is radio frequency, and essentially what that is just heat. So when we use radio frequency, it actually heats up the skin and causes what we refer to as a thermal injury. It's a good thing and something that we are intentionally doing in a very controlled way. And the reason we do it is because it creates new collagen and elastin as a part of the body's healing response to that injury that we're creating through the heat. So if you've ever had a pedicure and a hot stone massage, it's almost identical in how it feels. So it's very relaxing. And essentially what Tempsure Envy technology will do is minimize your facial lines, wrinkles. It tightens and lifts your skin, and it does it in a way that it's just topically applied. You can come get, little lunchtime facelift if you please. And it's something that regardless of whatever time of year we're in or whatever your skin type is, you can benefit from this treatment. There is no downtime with it. You might be a little pink post-treatment, but essentially we are just bulk heating parts of your tissue. So you're coming in for a dry eye treatment, which I know we're going to show you guys a little bit of what that looks like. We're going to focus in a couple of treatments on your eyes. Each of your eyes will get 5 minutes of treatment time. And then we might also treat your forehead, maybe your cheeks if you're coming in for a full face. This is something we can use any time of year, anywhere on the body. And so whether you are anti-Botox, which no shade if you are, or you just want to add some plumpness and some rejuvenation to your skin, or you're coming in because your meibomian glands are clogged and Dr. Foley has said, oh my goodness, we cannot take this anymore. We can actually utilize this same piece of technology to actually unclog those by the spreading of the heat and warming up that tissue, allowing those oil glands on our lash line to actually naturally express and release that oil so that we alleviate our dry eye. So and Gabby, you can go to the next slide, please. Part of why this is important is when we are in our 20s, going into our 30s, we stop making collagen and elastin at the same rates that we used to. And essentially, we liken collagen and elastin to being like the structural building blocks of our skin. So, I think we've all probably seen an older person, maybe in their 70s, where the skin on their hands, if they pull it, it stays up, or they don't have that elasticity and bounce back that we see in maybe a 20-year-old, or of course, even in babies, of course. But essentially what happens between 20 and however old we end up getting is we just lose that collagen and elastin over time. And essentially our skin loses its laxity and firmness. That can cause eyelid droopiness, that can cause lower lid droopiness, both of which can contribute to ocular surface disease. But additionally, what ends up happening, right? We get to be, say, 50, 60, 70 years old, and we're like, oh, gravity is just really taking its toll on me. And ultimately, it's not necessarily gravity. It's just the fact that over time, we just don't have that structure in our skin anymore. So doing something like TempSure is a very safe, controlled, and therapeutic way to deliver energy into your skin, stimulate your body to create more of that collagen and elastin, and restore that overall appearance and structure and strength into our skin. Ultimately, the result of that will also equal reduction in fine lines and wrinkles, especially in our crow's feet. We see really great progress in nasolabial folds, which are the lines here. If you have jowls or laxity on the underside of your face, we can also treat that as well. And so this is something that really just offers a lot of solutions for different patients. And it's really enjoyable and relaxing, relatively quick to get the treatment done. So essentially, we can pop over to the next slide, Jill. Gabby, sorry, I almost called you Jillian.
That's okay.
So TempSure really is this beautiful solution. It's really going to help minimize your fine lines and wrinkles, tighten your skin. And then as it relates to meibomian gland dysfunction, right, that's the clogging of the glands, essentially where our lash line is. What we're going to do is utilize that heat to spread, open up those glands and help them naturally express. Like I said, it's safe for all skin types, and it's something that you can do any time of year without having to worry about, downtime, or even some of the considerations that we normally think of when it comes to aesthetics or energy-based treatments. We're thinking, oh, okay, what amount of time do I not need to be in the sun, et cetera. And so some of those things are not quite as applicable here, which is really wonderful because it makes it so much more accessible.
Okay, I'm sorry, my presentation was going a little crazy on me. Let's see if we fix that. There we go. Okay. All right, I'm hearing your poor voice. So I'll go ahead and talk for a little bit to give you a break.
Thank you.
Okay, so a lot of people wonder, how does this work for skin tightening? Obviously, it's really you can kind of understand with the glands how heating up those oils is going to help express them. But for skin tightening, it kind of has a little bit of a different way that it works. So, there's kind of the stages of the skin healing, like Lauren said earlier. Basically, we go ahead and we apply this radio frequency and it heats up your skin. This heat is actually causing those cells to oscillate a little bit, which is just a rapid movement. And that's what's going to cause that micro injury. That's what's going to trigger your body to continue healing and continue going as we go through the treatment series. So you'll notice, like, right after treatment, you're going to look glowy and it's going to look tighter. But as you keep on going with more treatments through the series, you're going to notice a huge difference. So it does take a little bit of time for that collagen to continue remodeling, but it's basically all through that little micro injury. And we'll see if my slideshow wants to work with me, because it's been playing with me a little bit. Okay. So during the treatment, you're going to feel a warm sensation. I like to kind of explain it as it's going to feel hot tub temperature. We keep it in the 39 to 42 degrees Celsius range. And that's where we found best results for not only skin tightening, but as well as those glands. So that's going to be the perfect temperature to warm up those oils, get them to express, as well as get those cells moving, causing that tightening effect. When we do a full face, it takes about 45 minutes. When we do the eye only treatment, Amy, is pretty quick. And, as long as you warm up pretty quickly, it's less than 30 minutes. So it is a really good lunchtime treatment. I have the spinning ball of death on my laptop.
You're good. I just want to add into, the amount of people I've actually at events with customers, right? When we get crazy and do things in person, I've had people that have almost fallen asleep on the table just doing their forehead, because it is such a relaxing and enjoyable treatment. Oh yeah, Amy, are you? Do we have someone falling asleep right now live on camera? It's just such a wonderful treatment, and the benefit, the only thing you can do is benefit from this. And that's something that I love so much about it. Just a personal antidote. I don't know if you still have the spinning wheel of death, Gabby, but I personally I've suffered from dry eye for a long time. And since moving from the Carolinas to the Northwest, it's gotten worse. And I was fortunate enough to have a full face temperature treatment done. And I can attest to the fact that you will probably fall asleep during it. But also even and also too, right? I'm in my late 20s. We recommend one of these treatments per decade of life, which we'll kind of get into as to why. We've touched on it a little bit, but ultimately I actually saw some alleviation from my dry eye after one treatment. And my gosh, a medical procedure that you enjoy. It's unheard of.
Also pictures can help find come on now.
Did not fully catch that. I don't know if that was just me.
Getting the fine lines and wrinkles taken care of too.
Yes, exactly. Whether you want it or not.
Okay. Oh my goodness. This one is not working with me. Does anyone else have the presentation available?
I have it. Yeah, I have it. I can go ahead and swap with you.
Would you like to swap with me? My my computer is hating me. It's embarrassing. Of course it happens for the event.
Okay. Oh, there's the share screen. Wow, I have not used Zoom in a hot minute. All right, we're just gonna go desktop, share.
You're a lifesaver.
Boom. Can you see it?
Yes, perfect.
Yay. Okay, so I think we covered during the treatment.
Yes, feels amazing. Hot stone massage, pretty quick, beautiful.
Absolutely.
So after the treatment, just like, if you are all a little pink after a hot shower, you might experience a little bit of flushing just from the heat of the treatment. Otherwise though, you're kind of just left with a glow. Like, you're not going to have any crazy side effects afterwards. This is a really nice treatment because you don't have any downtime. You don't have to be careful about getting in the sun afterwards. So it's kind of like the perfect treatment for, my clients that hate sunscreen, and that refuse to wear it, this is like going to be your best friend, even though I want you to wear sunscreen. Okay, and again, it's very relaxing. You know, it feels like a hot stone massage, and you get that glowy skin afterwards. And I do have people that they tell me after their series of treatments, they say, oh my gosh, my friends told me that my skin looks amazing and I didn't even notice the difference. And it's definitely, I always like to tell people, take a picture of yourself before you get treatments done, because then you'll see at the end, you'll actually be able to see all the results that you got from it. So it's pretty amazing, and you get that glowy and you can't stop looking in the mirror, and it is awesome.
I love it. Yeah, I think it's an amazing like red carpet treatment, you know, like if you have an event or a party to go to, getting this done a couple days beforehand will only serve you.
Mhm.
And that's
So-
one thing to mention too. Just know that if you do, like, say you're scheduled on a Friday, you have this big event Friday night or Saturday, you will absolutely have no problem going to it. There is no downtime for this treatment.
All right, so we have a couple of before and afters around the eyes, and these are some before and afters that you can expect if you were to get the eye treatments, because we go right through in kind of a C pattern around the eye. And so we kind of get all that important bits, the little crow's feet and, you know, any little looseness underneath the eye that people experience. And so this is amazing. And this is only after 2 treatments.
Yeah, both of them.
So that is amazing.
It's awesome. And here's just another angle and some other pictures. So okay, all right, so we see her progress now after 3 treatments, and then our other model over here after 1. It's pretty awesome. And we kind of touched on it earlier, but so we're going to recommend always 1 treatment per decade of life. And the reason of that, right, as we talked about earlier, is we stop making collagen and elastin at the same rates we used to when we're in our 20s and 30s. And so the further we get away from, say, 25 years old, the more treatments we need to kind of catch up the clock. And by no means is this permanent, because we cannot stop you from aging. But it is something that's going to give you a longer lasting result. We typically see that the collagen we create will last us about 5 years after the initial treatment series. So that's wonderful when we think about what we're really accomplishing and achieving there. And like Gabby touched on, these are the types of results you can expect to see. I actually met a gentleman who he had to go through 7 treatments to get this result, but he was initially looking at getting a blepharoplasty. So a lid lift, essentially. He had just so much excess skin up here, it was impeding his vision. And he was able to do a series of 7 of these treatments and avoid having to go under the knife, which honestly is a lot of why people choose this, right? You're going to come in every about 4 weeks for a treatment. So if you're 60, you might be working at this for 6 or so months. But ultimately it helps avoid some of the risks associated, of course, with surgery, but also the downtime. And certainly for some people, I know the anxiety that comes with doing a surgical procedure. So it's really wonderful what it can help people achieve. And it's been pretty cool to see that.
As well as, yeah, I'm sure Dr. Foley can correct me if I'm wrong, but I'm pretty sure having surgery around the eyes also affects dry eye. So that is very good to stay away from the surgery if we can. So that is perfect.
Yeah.
So Temperature Envy, I mean, pretty much everyone can get it done. Unlike IPL, where you have to have lighter skin so that it doesn't target the melanin in your skin. Temperature Envy, anyone can have it done. If you're tan, anyone can have this done. It's just the perfect treatment. You can get it any time of year without any worries. So it's very nice that this is available to everyone, because it can make such a huge difference with your dry eye or just with overall, you know, vanity reasons. So this is like a great treatment to offer, because a lot of people, you know, sometimes can't get advanced treatments done.
Yeah, and it's funny you say like for vanity reasons. I think our team here, and our team includes Foley Vision, right? We crush it in the Pacific Northwest providing radio frequency treatments, and it's because it's a natural way to achieve like younger, brighter, tighter looking skin, right? Not everybody wants to get Botox, fillers, certainly not surgical intervention for aesthetic or vanity reasons. And so it's just unbelievable to see what we're able to help people with if they're coming at it from solely a aesthetic perspective, because this is something where no one's going to know you've had anything done if you care about that. And it's a way without needles and without downtime, you can achieve that tighter, brighter, smoother looking skin. So it certainly is taken off here in the Northwest. We see quite a few people who are pretty happy with it for those reasons.
Well, and we also have one of our wonderful folks that's tuning in tonight who's had this. She says, from experience, I can share that Tempsure Envy helps you, 1, see better with remarkably improved vision, 2, feel better with improved comfort and reduction of that annoying something in my eye, 3, look better with immediate reduction in bags around your eyes, red-rimmed eyes, and then the long-term collagen improvement. With Dr. Foley's recommended combination of Tempsure Envy and IPL, this treatment will improve atrophy of the meibomian glands. And she spelled it pretty close to true. All right, Terry, thank you. That was really a lovely comment. And I would heartily agree that this has become the go-to treatment for me after, specializing in this area for 15 years. Really, radio frequency needs to be done for all of our patients to build that structure function back. As people hear me say this over and over again, those lids get lax and they open up and air comes through when you're sleeping at night. Even our poor folks that are sleep apnea folks, they have what's called leg ophthalmos, loosey-goosey lids. So they get that blowback from their CPAP machines, and it can cause quite a bit of damage to the ocular surface. So this makes an immense improvement in structure function and tightening, which I love, because now their lids close all the way when they sleep, which is amazing. And they don't have to wear all those sleep goggles. They're already feeling like I have a ton of stuff on their face already. I don't know about you guys, but the older I get, the more things I have to do before I get to bed. It's amazing. Lid wash, mouth guard, what can I say? I'm not gorgeous when I go to bed at night anymore.
Oh God, I'm losing my mind already with the mouth guard. I can't wait. No. Like already that, and my poor boyfriend started dating me before I got the mouth guard. I'm just like, hey, like this is what you have now.
We love you despite your mouth guard, Gabby. It's okay.
See all the real truths come out in these wonderful webinars. It's great. It's great. You get to learn way more about us than you ever wanted to, I'm sure. But, it's just a wonderful thing to know that, hey, these things really help on a myriad of different levels, helping with quality of life. And, another thing that Terry was talking about in our chat, she says, this treatment is so much more comfortable than LipiFlow. And Amy has sensitive, gentle hands, and she does. She's marvelous. She does all of our treatments here in the office, and we all love having Amy take care of us. She is truly just a caring person who loves to do this. So, gosh, are you ready for your close-up here, Amy? Okay, I think
yes, ma'am. Let's do it.
Okay, we're going to show a live treatment here. This is Dr. Coulter, who suffers from ocular surface disease. And there we go. You can see she has had the Be My Lady steam heat mask, which I absolutely love. I love these. You can get them on Amazon. It's a wonderful way to get heat. 40 degrees Celsius is it's going to heat you up for 40 minutes. And we try to preheat the skin. Amy's now putting on some warm ultrasonic gel so that we can use that to help conduct the radio frequency waves. And we need to have just the right amount of gel on that periorbital area. She's going to go over the lids a little bit. She's going to see how we do the periorbital area and then how we do the lids. We don't need to use a corneal shield in this particular case because we're not going on the globe of the eye. So we're doing it very safely. And it's very comfortable. I know for myself, when I have this done, I feel so soothing. And if you have a sinus infection or anything going on, it just opens up those sinuses beautifully. You're going to hear the music. We can't turn it down because the FDA requires that it has this nice, lovely, relaxing tone, because you need to know that this system is actually on and being in motion. You can see that she's, warming up really nicely. Amy's got just the perfect amount of pressure going because it just glides smoothly across the skin. How's that feeling, Dr. Coulter? Oh, she knows I'm like, yeah.
She says it feels good. She can't hear you, Dr. Foley.
There you go. I know we can't be broadcast all the way across the office, but that Be My Lady steam heat mask is great to get just for home treatment, just to sleep. It's wonderful, super cozy. So we usually do about 3 minutes periorbital. This is what we're doing right now. You get a little bit of feedback from the music. And it just,
I just hope everyone's imagining right now just like this warm, cozy massage around your eyes happening, because that is what we're experiencing here.
I wanted to be the model for this so bad. Like, I'll stay late. Like, let me be the model.
yeah. So you can see this a little bit better now. We've got a little better close up. Thank you, Stevie. We'll be posting this on the website. We were having a little hard time with the live stream earlier, so that's okay.
Well, and I think one thing to touch on, right, is especially if you're coming in for a full face treatment, we break the face up into sections because we're bulk heating each piece of tissue based on the size of the handpiece we're using and the overall surface area we're covering. So what you'll see is we'll focus in on this area for, that amount of time. We'll do the other eye for the same amount of time. And then, depending on your forehead size, right, you might break your forehead up into 2 sections. Same for cheeks. We might use a bigger handpiece so that we still work within a smaller amount of time. But we're bulk heating that tissue to get that neocollagenesis, to get that skin tightening and get that heating the way we want it to disperse out, especially for those lash lines, to go ahead and open them up and let those clogged oil glands live their life and be free.
And I just want to remind everybody that you can use that on your neck also, your hands, your arms. It's amazing. Sky's the limit.
Stevie's like, and what I do on my lunch break is.
So I can prove it can be done on a lunch break.
Exactly.
The only thing is, just a reminder, if you are going to be coming over on a lunch break, we have to remove makeup. So if you're a makeup wearer, make sure that you bring your makeup so that you can reapply when you're done.
Yeah.
Another thing for the lunch break goers is that if you are good and hydrated the day before, you're going to heat up a lot quicker when you're good and hydrated. That's kind of what it works. So the more hydrated you are, the quicker your skin will heat up.
Well, and the more hydrated you are, the better it works for you. So just make sure that you drink your water.
That too.
Yes. And I love to get nerdy with it, right? So, I mean, when we talk lasers, right? Lasers are all wavelengths targeted towards something. When we talk about radio frequency, the way radio frequency is conducted is through water. And so that's why it's so important for you to be hydrated. When the way that the Temptures platform works is it's going to give real-time feedback as it treats to ensure that your skin is at the appropriate temperature, and we're giving you a therapeutic delivery of this energy. And so the more hydrated you are, the more efficient your treatment time is. Get that water going. You should be drinking a lot of water anyway, and wearing your sunscreen, but that's a different TED Talk. So
I know, I swear we're gonna have a whole event an hour long talking about sunscreen and water and all the things that.
So what Amy's going to do now is she's going to work on the lid. and this helps with more expression. And she's adjusted the temperature or the energy setting down just a little bit. So because the lid is thinner than the periorbital area, but we have a special technique where we don't have to put the corneal shields in, and it's comfortable, it's more comfortable. And so it just is 1 minute on the upper lid and 1 minute on the lower lid, very, very quick for a total treatment time of 5 minutes per eye. So it doesn't take a lot of time. It's very efficient, as long as the patient is well hydrated, like you guys heard, and are nice and toasty warm. Dr. Coulter's got a wonderful weighted blanket on her with a neck wrap to heat her up, and the Be My Ladies to get her cozy and warm. Yeah. You can tell she's almost falling asleep. It's not like she's
I was
pulling
ju-
away.
I was just gonna ask that. Is she awake?
She's awake.
Okay.
So
Got it.
the only like contraindications for someone getting this treatment would be if you have any type of implanted metal device, if you have something that conducts, like we have people that have like diabetes pumps and stuff. If you can turn it off, then we could be in okay standing, but we want to be mindful of that. The other piece is that we always take caution with people who are pregnant or breastfeeding. And so just consult your doctor if you have any concerns or worries, but essentially this is safe for everyone to use. So I just want to throw that out there.
The only implants, besides teeth, if you have teeth implants, it's fine.
Teeth implants?
Yeah,
Yeah.
because when we say if you have anything implanted, they say, oh my gosh, I have teeth, or whatever, we can tell them that, no, it's fine, you can, if you have teeth implants or fillers or whatever, that's fine.
Perfect. Yeah. And even people that have braces and stuff, we can always put gauze, just some wetted gauze in between your lip and the braces so that as we're treating, if we are treating around your mouth, we're not heating anything up.
Oh, I've never done anybody with braces. Somebody with braces, please come in so I can do it.
So you want to ask Dr. Coulter how she's feeling right now?
Dr. Coulter, how are you feeling right now?
I'm feeling wonderful. It's like a hot stone massage.
Good, 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 good. Yes, this is what all of us at Fully Vision love to have for our little breaks in the day. We'd love to do this every day. I'm sure Amy would be very busy with all of us.
I'd be okay with it.
I know everyone's always fighting over getting treatments by Amy. And I'm here like, I'll zap your face. Everyone wants the nice, comfortable spa treatment.
Mm-hmm. Yes.
It's okay.
Dr.
What you do matters too, Gabby.
I know. I keep on telling Amy, I'm like, I need to steal your job and take your clients so they'll like me.
Nope, I'm not giving them up. Sorry, Gabby.
Well, Terry also brought up here on our chat. She says, I drive a minimum of 90 minutes one way because the procedures Dr. Foley uses in her clinic actually work, exclamation point. And Amy makes it feel more like a spa pampering than a medical treatment. Thank you, Terry. That's very sweet.
Thank you, Terry.
We're going to have you as an honorary glamour gal, Terry. I think that
Yes.
you are wonderful. We appreciate all the feedback. And, I find our male patients actually talk about this more sometimes than our female patients on their follow-up visits. We've had many of them kind of look a little bit depressed when I see them for when they're after all of their treatments and I'm seeing them for a medical ocular surface check. We've had a number of them just go, I go, what's wrong? I'm thinking, oh dear, they're unhappy with the treatments. And they just look at me and like, I miss Amy. She makes me feel loved and pampered. I'm like, oh my gosh. Well, of course you can keep coming. You can come just for the pampering. That's okay too. So it's lovely to see that we have something that works medically, but also is so, comforting and cozy. And, that's kind of what everyone needs right now. You know, we've all been through a lot of stress the last 2 years, and this just kind of melts that stress away. We also have another question. Does this also treat for styes or chalazions? And yes, it sure does. And in those situations where you have a lump or bump that's inflamed on the eye, we do what you're seeing right now, the periorbital region, and Amy will do that for me and heat them up nice and warm. And then I will slide in a plastic corneal shield to do just specific area where that sty is, to lift that lid off so that it stays sterile. And that works very, very well at breaking up the sty, and that helps it heal very, very quickly. We've had folks, including Stevie over here, who's had treatments. And poor thing, she had a really massive one day, and she's like, now I know what our poor patients feel like, right, Stevie?
It was hideous. My patient said it was worse than they've had. Worst they've ever seen.
The nice thing is, yeah, a lot of times we'll use radio frequency and do an IPL right on top of it. And, you know, we've had people where they have a wedding or something in 2 or 3 days, and that can just get rid of it. It's amazing, just amazing.
Yeah, and thank God I work here. I was not having it.
Access to the equipment is a
Yeah.
gift and a blessing.
And a wedding. I mean, think about that. Do this the day before you go to a wedding. The bride will hate you. She'll hate you. Oh, I know. Even better. Class reunion. Oh no. Ex-boyfriend's wedding. Yeah, that's what you want to do.
All right, I'm calling Stevie next time I need to be petty and get revenge.
Oh my goodness, yeah, you don't want to be in those pictures that are forever lasting, right? That would be something else. It's either that or you're going to go with a pirate patch because you're
Right.
afraid to be seen. That would be good.
Mhm.
Yes. Well, we do find by the time we get to that second eye, people are just so relaxed now because they're a little initially at first a little anxious, which is normal. And then they get over that pretty quickly. And that second eye, many times we have people completely snoring. I'm sure Amy can attest to that. So she's had many people fall asleep on her. She's so gentle. As you can see, she uses a special gauze to lift up on the upper eyebrow area. Right now, generally speaking, we'll tell patients to look just slightly down because your natural tendency is to look upward when you close your eyes. But, you know, this is just very gentle. Right on that brow bone is where we're working. And the radio frequency waves go deep and wide, all the way down into the dermal tissue, hiding the water molecules deep in there that get those meibomian glands pumping and heating up, and the glands expressing beautifully. So we don't need to express manually after we do these treatments, which is much more comfortable for our patients. And, you know, people love that feel. Plus, they love the glow immediately. And like Lauren and Gabby have mentioned, you can put your makeup on immediately afterwards. There's no downtime. It's wonderful, absolutely wonderful. I always try to do my treatments towards the end of the day. I have had them done the beginning of the day, and then I don't want to go to work. I just want to go take a nap. It's lovely. It's absolutely lovely.
It's amazing too if you're a furrower like I am. Whenever I've had a treatment done during like lunch or end of the day, because always those are just indented. Like at the end of the day, they are there and there is no hiding it. And then having this done, it just erases them for the rest of the day. And I'm just loving looking at my brows and everything. It's amazing.
That's great. Yeah, you can tell Dr. Coulter's looking really relaxed right now.
Are you relaxed, Dr. Coulter?
Relax.
I know we're gonna need to get her a ride home.
Right.
I
know
think
we're not gonna call her
so.
husband to come get her.
All right, I'm going to take you out of the spotlight there, Amy and Dr. Coulter. So here we go. All right. So now it is Miss Stevie's time to shine. Stevie has got our wonderful prizes for those of you who have stuck around to the bitter end here. Questions first off, anybody else have questions that they want to put in the chat? We have another one. Oh, thank you, Terry. Very educational and informative. I've always am learning something new at these events. Thank you. Thank you, my dear. You're amazing. So feel free to jot in any questions as we go. I think Stevie's got the floor now.
All right, well, now it's my turn and hopefully that works. Can we hear it? Can we hear it?
Yeah,
Okay,
I'm gonna mute
Yes.
myself.
That means it's the best time of the night. No, I'm just kidding. So tonight, we'll be giving away 20% off to everybody who calls me tomorrow and by noon on Friday. And just mention that you were at the event and you will get 20% off of any treatment package. And so tonight, I'm gonna do the drawing for a full face radio frequency. This is really the one that you want to go to before your ex-boyfriend's wedding. So I'm just saying, I'm just putting it out there. All right, so let's see who it is. Connie Rolfe. Connie Rolfe. So there you go. So just give us a call or give me a call tomorrow, sweetheart, and then we will go from there. All righty. So there we go. All right.
Well, thank you, Stevie. That was awesome. And I think Connie's going to be absolutely thrilled as can be. Tonight's
Yes.
going to be recorded. And yes, Connie says, yay, thank you, Stevie. Woo. That's awesome. That's awesome. We appreciate every single one of you for sticking around this evening. Hope you're having a wonderful evening. And gosh, guys, it's almost time for May. Can you believe it? This month and this year is just rocketed by. Next month, we're going to be doing it May 25th. Put that in your calendar. And we're going to be going over ocular surface disease and lots of different things and cool things, some things you can do over the counter as well to help yourself out and pamper yourself and make you feel good. Every month this year, we're going to be doing something different, but we do want to get some feedback from all of you. We're thinking about maybe doing a lunchtime gig here on maybe on a Thursday occasionally, because we do know some people are tired by the time 6 o'clock rolls around and they might want to do a lunchtime thing with us. So if that's something you think you might be interested, give us some feedback, let us know. We want to keep this, moving and grooving, but we are committed to every single month this year, and we've been having so much fun. Hopefully it's you guys getting to know us a little bit better and joining our wonderful club of glamour gals here at Foley Vision Center. Anything else anyone wants to share before we say bye-bye? No? Okay. We're going to let you all go. Thank you, Amy. You did an awesome job.
Good night, you guys.
Good night.
Yay.
Thanks, Dr. Foley. Great job.
Thank you, Lauren. Thank you so much. Bye.
Bye.